All right, so these are standing extensions, a common back exercise. The parameters for this are going to be 10 times for 10 seconds. So what you're gonna do is you're gonna have the patient, they'll be standing, to lean back. It can help to put like your hands on your hips, just kind of bending that lumbar area of the back. You're gonna hold that for 10 seconds, relax, do that 10 times.
So when we were teaching patients how to use their transverse abdominis or their deep abs, this is how we'll do that, okay? So what I explained to the patient is I'd say, Jessica, there's that muscle. It's the deepest one in your stomach and we're gonna practice turning it on. But it's difficult to do, so we're gonna coach you through it, okay? So what I want you to do is when you turn on this muscle, I want you to imagine that you're tightening your lower stomach, but really deep down, okay? So what people can imagine is pulling their belly button towards their spine as if there was a muscle pulling them together, okay? But there's a way we can feel it. So what we do is we're gonna have you touch your hip on that side, I'm gonna touch your hip on this side. So you find your front of your hip bones right here, and then you're gonna drop your fingers just right here in kind of this soft spot, okay? So where this muscle is it's right deep down, right below where our fingers are. That's where I want you to feel it just gently tightening, like there's a floor, like it gets hard at the bottom. Does that make sense? Okay, so relax everything. And then what I want you to gently do is just gently try to pull that belly button towards your back and tighten your tongue. Very good. So this exercise can be very challenging for patients to understand. If they need help, the therapist can work with them. But some common mistakes you'll see is if they tighten all of their abs and you see their stomach go tight or they're not breathing well, they're over clenching their muscles. So pay attention to that. Also, usually when they do core exercises for strength, they need to turn this muscle on first. So if we were to do a bridge with this, we'd say, Jessica, turn on your deep abs and then bridge your bum up off the table while keeping your abs on. Go ahead and try it out. And then lift, and then slowly lower it back down. Keep your abs on. Good, and then you can relax your abs.
All right, so this is the upper spine floor stretch, often abbreviated USFS. It also can be called open books. So what you're gonna have the patient do for this one is they're going to lay down on their side. You wanna make sure they're nice and vertical. They're not open or like closed. Their feet and hips in alignment, just nice and straight. Their hands are gonna be together, just straight out, and you can give them a pillow. Just going to be opening up like this until they feel a good stretch. Hold that for 5 seconds and do that 20 times on each side. Another thing you can have them do is as the patient opens up, once they're open, you can have them take a deep breath. And as they exhale, have them come back in, and that can help them get a deeper stretch in their back. All right, so these are hip rockers. They're also called knee knots. Lay down in a supine position. They're gonna put their feet together and their knees together, and they're just going to be rocking from side to side, making sure their shoulders stay on the ground. They do this, and this helps them get a good range of motion in their lower back. 20 times for 5 seconds, holding on each side. One important thing to mention to the patient, keep their feet on the ground. Oftentimes, they'll lift their feet up or do other things that make this like really, really hard to do and more of an ab workout. This isn't an ab workout, it's just kind of like a stretch.
All right, this is called the child's pose / prayer stretch, and it's a good stretch for the lower back. What you'll have the patient do is kneel like this on the table, and then they'll just bring their arms forward and hold it like this for 30 seconds 3 times. And it's important that they don't bring their butt off of their heels. And also if they're having trouble feeling the stretch, they can widen their knees a little bit, and that just allows them to get a little bit deeper into the stretch. All right, this next one is called the glute or crossover stretch. And what you'll have the patient do is lay down on their table, and they'll have their hip down and their shoulder down. It's really important that they keep these down on the table, and they'll just kind of pull their knee across like this until they get a nice stretch in their glutes. Some people feel it more as they bring it more up towards their opposite shoulder. Some people feel it just fine just going across that, and hold it there for 30 seconds 3 times. On the chart, if it says glute stretch, think more pulling it up towards the opposite shoulder. And if it says crossover stretch, it's more just pulling it across the body like this. All right, this next one is prone on elbows, or POE, as you'll see on the charts. And what you want the patient to do is they'll start just kind of relaxed laying like this, and they'll just bring their back into extension like this onto their elbows. It's important that their abs and everything are just nice and relaxed so that they can get a good stretch in their lower back. And they'll hold it for 30 seconds 3 times. It's also important that they know it's not a plank. This is supposed to be a stretch, not an ab exercise. If they're feeling pain coming up this far onto their elbows, they can have a pillow underneath so they're still getting a little bit of a stretch, or they just come up a little bit, still relaxed.
Before you do anything, you're going to turn on that core activation like the therapist has taught you, that TA bracing. So once you do that, you're going to grab the strength that you want, and you're going to put your hands out like this. You don't want them turned to the side or forward. You just want it straight in front of you. And then you're just going to walk out, taking 3 steps, making sure not to twist at all. You want your hands staying nice in front of you. If you need to adjust the strength, do that so you don't have to twist at all. 3 steps back in. You want that to be nice and controlled. It's going to be 3 sets of 15 on both sides to make sure we're even. A lot of the therapists will alter this depending on the patient and how they like to do it. You can check the chart or talk to the therapist to see how they want it. Called dead bugs. So what you're going to have the patient do for this is they're going to lay down on their back in the supine position, and they're going to lift their legs and arms up, making sure their back is flat on the table. And then they're going to alternate extending the opposite sides of their arm and leg. It's going to be 3 sets of 15. One thing patients will do when they do this is they'll like arch their back like up like this. You don't want them to do that. You want it to stay nice and flat so they're getting that core activation. Just like this. All right, so these are prone presses or prone press-ups. What you're gonna have the patient do is they're gonna lie down on their stomach like so, go all the way down, putting their hands on either side, and then they're just going to press up like this, kind of like a push-up, except not. Hold it for just a couple seconds, like 3, and then come back down. It's 3 sets of 15. You want to make sure and emphasize that they don't push into pain, so if they can only go up like this far, that's just fine, or even less. You know, stop before there's pain, hold it for a few seconds, and go back down.